Have you ever woken up and been completely paralyzed? You're completely awake, but you're suffocating and you have terrible chest pain, and you feel like something evil is menacing you. And although you're completely terrified, you're unable to move or escape. This is sleep paralysis, and it affects 8% of the population. It's common, it's terrifying, and it's real. Hi, I'm Dr. B. On this channel, I explain common mental health conditions to help you understand yourself, your loved ones, and those in your community. Today's video is on sleep paralysis. It's a terrifying and common condition. Watch this video to learn what sleep paralysis is, learn the biologic basis for sleep paralysis, why it happens, learn the 3 most common terrifying hallucinations that occur during sleep paralysis, then stay until the end to learn to see if there's any treatment. Sleep paralysis is a temporary inability to move. This occurs right after falling asleep, or more commonly, just before waking up completely. Individuals remain aware during these episodes, which frequently involves troubling, fearful hallucinations and a sensation of suffocation combined with terrible chest pressure. Now, from the description, clearly an episode of sleep paralysis is terrifying and scary. And research shows that people throughout the world in countries as diverse as China, East Africa, Mexico, Newfoundland, and the United States have long believed that paralysis is caused by demons, witches, or other supernatural creatures. But to understand the science behind sleep paralysis, let's first dive into the sleep cycle. The normal sleep cycle is about 90 minutes long and divided into 2 segments: rapid eye movement, or REM sleep, and non-REM sleep. Non-REM sleep occurs first and takes up to about 75% of your overall sleep time. During non-REM sleep, your body relaxes and restores itself. At the end of non-REM sleep, your body shifts to REM sleep. In REM, your eyes move quickly and dreams occur, but the rest of your body remains very relaxed because your muscles are turned off. Yes, you are effectively paralyzed in REM sleep. The medical term for this is atonia, meaning your muscles have no tone. They can't contract. Normally, because you dream during REM sleep, the atonia allows you to actively dream, but you won't move. Now, in a normal sleep cycle, you aren't aware during the REM sleep. Sleep paralysis is different because you become aware while still in REM sleep. So if your body wakes up before the REM cycle has finished, you are disconnected from your body and you cannot move or speak. This can last up to seconds or minutes. That is why it is so terrifying. You feel wide awake, but physically completely helpless. Because REM sleep is also when you dream, in sleep paralysis you experience hallucinations that seem dreamlike, but also very real. Now, unlike dreams, specifically in sleep paralysis, these hallucinations are often, most commonly, 3 common categories. And these common categories occur across all types of people, regardless of country, language, or ethnicity. The first type of hallucination is known as an intruder hallucination. This involves the perception of a dangerous person, a presence, a demon, a robber, someone in the room, someone that's trying to kill you, hurt you, or your family, and you're paralyzed and helpless to stop. The second type of hallucination is known as chest pressure or incubus hallucinations. This is a feeling of suffocation and chest pressure, and they very commonly occur alongside the intruder hallucinations. The combination of the intruder hallucinations and the suffocation feelings adds even more to the terror. The third type of hallucination is known as VM or vestibular motor hallucinations. These include feelings of movement such as flying, falling, or out-of-body sensations. Now, the combination of atonia, remember the inability to move, and these troubling hallucinations make 90% of sleep paralysis episodes terrifying. Interestingly, 1 out of 10 people actually have pleasant or blissful sleep paralysis hallucinations. So what are the causes of sleep paralysis? Well, we don't have very definite research, but based on the research that is available, researchers believe that there are multiple factors involved in provoking sleep paralysis. It is especially associated with what is known as obstructive sleep apnea, which is a sleep disorder where people have repeated lapses of stopping breathing during the night. Now, sleep paralysis has also been found to be more common in people who have nighttime leg cramps, people with anxiety disorders, panic disorders, and it has a strong association in people with post-traumatic stress disorder and a history of childhood sexual abuse and other types of physical and emotional distress history. What is the treatment for sleep paralysis? Well, the main treatment is improving sleep hygiene. That's the most common focus to prevent sleep paralysis. Sleep hygiene refers to a person's bedroom setting and daily habits that influence sleep quality, such as setting a routine bedtime, finding a good mattress and pillow, limiting alcohol and caffeine late at night, limiting electronic devices at least a half an hour before bed. There is also a specific form of cognitive behavioral therapy which has been developed specifically to use in sleep paralysis. This is a similar technique that is used to treat borderline personality disorder. There are also some medications that suppress REM sleep. Remember, sleep paralysis occurs because REM sleep and your body waking up are out of connection. This is usually used when other treatments such as improving sleep hygiene are not effective. That's sleep paralysis. Thanks for watching. If you want to see other educational videos, watch this one on locus of control and this one on avoidant personality disorder. And please don't forget to hit subscribe.